we have a 6 mark for digestive system. Take the heading and then corresponding code ranges. Yeah. Repair of lip. Okay. Vermilion is the lip as a part of lip. So vermilion only. Repair is nothing but suture. Surgeon make a suture. Okay. Surgeon just make a suture on our lip for 40650. For 1/2 vertical height or over 1/2 vertical height. That means, what did I show you? See that? This is a vermilion. Vermilion border and a vermilion. So repair of 1/2 vertical height or full half vertical height. Okay, that's it. Repair means suture. Surgeon just to make a suture 1/2 of the lip or vertical height. Okay, 1/2 vertical height or a half vertical height means go for 40650. 40650 over 1/2 vertical. More than half. More than half means go for 4650. 4645. So it's 654. Then repair of cleft lip or nasal deformity. So I think you already know that cleft lip or cleft palate. This is one of the congenital defects. So surgeon make a suture to repair the cleft lip or nasal deformity. For unilateral, go for 700. That is a primary procedure. Primary means in that repair of cleft lip or cleft palate, we have two classification, primary and secondary. Primary means this is a first time surgery for the patient. Primary means this is a first time surgery for the patient. Secondary means this is a follow-up surgery. Primary means this is a first time surgery for the patient. Secondary means it will be a second time surgery or a follow-up. For primary, unilateral 700. Bilateral stage 1 701. Stage 1 of 2 702. Stage 1 701. Stage 1 of 2. So then stages will documented by the provider directly. Don't do. And for secondary surgical operation of cleft lip or cleft palate, go for 70720. 40720. So these are the code sections for cleft lip or cleft palate. Then what is the procedure for 490? Biopsy of lip. Direct coding, no guidelines here. Doctor obtain the sample from lip, go for 490. For vermilion ectomy. Ectomy means removal. For removal, we already discussed that vermilion is a lip. So removal of vermilion 500. Excision. Excision means here excision of lip, resection of lip. What does the excision means? Doctor did not remove the lip completely. So excision means that is partial removal. Resection means that is a complete removal. Take a meaning. Excision means that is a partial removal. Resection means that is a complete removal. For excision of lip, for wedge excision, V-excision. These are the technique. These are the technique to remove the lip. For wedge excision, 510. 520. Then full thickness excision, local flap. If local flap means 25, cross lip flap means 26. Guys, doctor give a direct documentation for all of that. Don't worry. For wedge excision 510, V excision 520. For local flap 525, cross lip flap 527. Direct coding. What is the meaning of resection? Resection
Complete removal. Complete removal.
Complete removal of lip, go for 4053. That's it. Direct coding, no guidance. And the drainage. See that? This is a vestibule. Vestibule of mouth. Anterior and posterior. Okay? So, surgeon perform the drainage to drain the air, cyst or hematoma at the vestibule of mouth. So, the anatomical location is vestibule. For simple 800. Complicated means 80. For simple, go for 800. For complicated means go for 801. Now, what is the procedure of 804? What is the procedure? Removal of embedded foreign body. From where? From where?
Vestibule of mouth. Vestibule of mouth.
Removal of foreign body from vestibule of mouth. Same like that, simple 804, complicated 805. Then fernotomy. Fernum is 1 minute, I should. So see that this is a fernum. I think this is a clear image. Fernotomy. Okay, for fernotomy, surgeon make a cut on the fernum. For fernotomy, go for 40806. 40806 for fernotomy. Now, here laceration. Laceration is one of the deepest wound. Laceration means that is a deepest wound. Closure means repair. Repair means suture, stitching. Closure and or repair both are having the same meaning. Closure and or repair both are having the same meaning. Okay. So for closure, laceration of vestibule of mouth. Laceration, vestibule of mouth. If the suture length is 2.5 centimeter or less, 430. Over 2.5, that is 831. If the suture length is less than 2.5 or less, go for 830. Over 2.5 means go for 831. Then vestibuloplasty, repair, anterior, surgeon make a suture at the location of anterior vestibuloplasty, 840. Posterior means inside. Posterior unilateral 42, bilateral 43. So for the entire arc means the entire suture, the surgeon make a suture at the entire arc means go for 44. For complex vestibuloplasty means go for 840. For complex vestibuloplasty means go for 845. Here the extension with a rigid extension, muscle repositioning, these are the key terms for complex. So, rigid extension, muscle repositioning, these are the key terms for, these are the key terms. 1 minute. These are the key terms for complex. Direct coding. Now, tonsillectomy. tonsillectomy and adenoidectomy. See that adenoid and tonsil, removal of tonsil and adenoid. If a patient ages, now patient has a problem of both tonsil and adenoid. Patient has a problem of both tonsil and adenoid. Tonsillectomy and adenoidectomy younger than 12 year of patient age 820, 12 year or older 821. 25 and 26 are the tonsil only. Now surgeon remove the tonsil only younger than 12 year 25, 12 year or older 26. Suppose if a patient has adenoid only, go for the core section from 30 to 36. Same like that. Here in adenoidectomy, we have two classification, primary and the secondary. In adenoidectomy, we have two classification, primary and the secondary. Okay, we have two classification, primary and the secondary. So same like that, you have to check the patient age, younger than 12 year or 12 year or older. So when a patient has both tonsil and adenoid, means go for 20 and 20. Tonsil only from 25 to 26. Adenoid only means from 30 to 36. That's. Did you understand? Any doubt? Any doubt? Any question?
Here, ma'am.
Okay. Now try this question.
D, ma'am.
D or B?
बहुत अच्छी बात है, बहुत अच्छी. वो खाने का भी हो तो.
What about others? Is it correct or not?
अपने वो उसमें ना हकीम बासी बहुत बड़े बुजुर्ग है वो.
So correct answer. See that. Procedure, tonsillectomy and adenoidectomy. Patient age is 24 year old. As well as you have to check the procedure is performed or not. So identify tonsil, identified incision was made, dissection was done, extracapsular and the right tonsil was then removed. Both the right and the left tonsil was sent as specimen as well as adenoid tissue. So here in that last line, doctor clearly mentioned, sent the specimen for a tonsil and adenoid. Okay, so option D is the correct answer. 42821, tonsillectomy and adenoidectomy. Patient age is 12 year or older, so 42821. That is the correct answer. Did you understand? Any doubt? Any doubt? Esophagectomy. Sorry, esophagotomy. Esophagotomy. So surgeon make a cut on the esophagus. Surgeon just make a cut on the esophagus through the cervical approach. Cervical means through neck. Through neck. Surgeon make a cut on the neck and reach the esophagus. What is the reason? What is the reason for esophagotomy? Check that. What is the reason of that procedure 43020?
For removal of foreign body. Removal of foreign body.
So for removal of foreign body, to remove the foreign body from esophagus, so surgeon just make a cut on the neck and remove the foreign body means go for 20. So 45 means thoracic approach. To remove the foreign body from esophagus, surgeon make a cut on the neck, chest. Surgeon make a cut on the chest. So that is thoracic approach to remove the foreign body. 43045. Then cricopharyngeal myotomy means doctor just remove the muscle from pharynx. Doctor remove the muscle from pharynx. That is cricopharyngeal myotomy 43030. Then here, what is the reason? What is the procedure here in 4300? What is the procedure? Yes, what is the excision? Excision of lesion. Excision of lesion. So remove the excision, so removal of lesion from esophagus. Same like for cervical approach 100, thoracic or abdominal approach 4310. For cervical approach 100, thoracic or abdominal approach means go for 4310. Next.
Ma'am, can you repeat cricopharyngeal myotomy once again?
Removal of muscle from pharynx. Removal of muscle from pharynx. That is cricopharyngeal myotomy. Did you understand that?
Yes, ma'am.
Next. Now, see that in this procedure, total or near total esophageal ectomy. So, total or near total. Total means completely remove the esophagus or 80% or 80 above 80 to 85% of removal of esophagus. That is near total. Completely remove the esophagus or doctor just remove 80 to 80% of esophagus means that is total or near total esophageal ectomy. So along with if a provider, see that in this image, doctor cut the esophagus and the rest of the part, that means the doctor remove the esophagus. This is a near total. 85% of esophagus has been removed. Okay, 80% of this is a near total. 80% of esophagus has been removed, and with the rest of the esophagus, they pull the stomach into the chest cavity and connect with the remaining part of the esophagus. Doctors pull the stomach into the chest cavity and connect with the esophagus. So that is total or that is esophageal ectomy after gastro. See that esophagogastrostomy. That is the meaning. So during that procedure, if surgeon also perform the reconstruction procedure at the large or small intestine means go for 4310. Surgeon perform reconstruction procedure at the small intestine or large intestine means go for 108. Same like that, same procedure, total or near total esophageal ectomy. What is the difference for 107 and 112? What is the difference?
Without
Without thoracotomy, then with the thoracotomy. Okay, so without incision of chest, doctor complete the procedure. So same procedure, guys. Same total or near total esophageal ectomy. Here also total or near total esophageal ectomy. With the colon interposition or small intestine reconstruction. Here also the same. So the difference is without thoracotomy, without incision of thorax, doctor complete the procedure means go for 107 and 108. Without incision of thorax, doctor complete the procedure means go for 107 and 108. 112 and 113 for with the thoracotomy. Surgeon make a cut on the thorax and complete the procedure. That is the difference, but all of the core sections are same. Procedures are same. The difference is without thoracotomy and with the thoracotomy. That's it. Then we already discussed that 4321, 43112. Now,
ma'am, one term is, excuse me, ma'am.
Yes.
Ma'am, one term is there, na, Machion esophagotomy. So what is the meaning of that?
Listen. That is a procedural name. Okay, procedural. Machion esophagelectomy, that is a surgical name. Name of that surgery. Okay. And in 43117, surgeon make a cut on chest and abdomen. See that this is a esophagus. Surgeon make a cut on the thorax and the abdomen to partially remove the esophagus. For partial removal of esophagus, surgeon make a 2 incision. One is on thorax and another one is on abdomen. Go for 43117. Okay. Did you understand this concept? Did you understand?
Yes,
Guys,
ma'am.
please say yes or no. Did you understand the meaning of this procedure 43117? Yes, please say yes or no.
Yes, ma'am.
Okay. Please respond, guys. So colonoscopy. So before that, everybody please take a keynote. I will explain you later about all of that scopy, endoscope, colonoscopy, everything. So first, please take it. In digestive system, we have a different type of scopy for the entire alimentary canal. For the entire alimentary canal, we have a different type of scopy. Esophagoscopy, then esophagogastroduodenoscopy, ERCP. Take a note. Take a note, guys. Esophagoscopy. Scopy. That means esophago. Let me check that. Duodeno. Esophagogastroduodenoscopy, ERCP, small intestine scopy, ileum, jejunum ileum. Another small intestine scopy is ileum. Then colonoscopy. So these are the corresponding scopy for the entire alimentary canal from esophagus to colon. So here for every scopy we have a specific termination point. For every scopy we have a specific termination point. For example, 1 minute. Okay. For every scopy, for example, for esophagoscopy, esophageal junction is a key point. That is a termination point. Okay, for esophagoscopy, the termination point is gastroesophageal junction. For upper GI scopy, duodenum is a termination point. Duodenum is a termination point. For ERCP means endoscopic retrograde. See that. For ERCP, endoscopy, retrograde, cholangio, pancreatography. That is a full form of ERCP. Endoscopic, retrograde, cholangio, pancreatography. This is a key term. That is a full form of ERCP. For that ERCP, pancreas are biliary. Pancreas or biliary is a termination point. For small intestine scopy, for one type of small intestine scopy that terminate at the jejunum, another type of small intestine scopy that terminate at the ileum. Then a colonoscopy is cecum. Cecum is a termination point. For all of these scopy, we have a separate termination point. Every scopy must terminate at that particular point. So every scopy must terminate at the particular point. For example, suppose doctor insert the esophagoscopy through mouth or nose. Okay, through mouth or nose. So for esophagoscopy, gastroesophageal junction is the key term. So for a doctor, insert the esophagoscopy through mouth or nasal, but it does not reach the termination point. Means we should up and modify 52 or 53. So doctor insert the scopy through mouth or nasal, but can't able to reach the termination point. Means we should up and modify 52 or 53. (52) or 53 should not upon modifier, should not upon both of the modifiers. Okay?
Okay. Okay.
Okay. Now, this information is not only for this esophagoscopy, for the entire scopy. This information for all of this entire scopy. So for every scopy must terminate at the junction point. That means terminate at the every scopy must terminate at the point, at that particular point. Otherwise, we should up and modify 52 or 53. Otherwise, we should up and modify 52 or 53. Okay. So here, in that, so the reason for the scopy is same. Okay, for example, esophagoscopy, rigid transoral. So the scopy has inserted through mouth. Scopy has inserted through mouth, So rigid means the scopy does not terminate in the all direction. The scopy just terminate in a limited direction. Scopy that terminate in the limited direction. So that is rigid. So here also we have a code for flexible. Flexible means the scopy can turn in all direction. The scopy can turn in 360 degree in all direction. That is flexible. So here also esophagoscopy, flexible oral. Here rigid oral. But the reasons are same. Brushing, washing, 191. Submucosal injection, 192. Biopsy, 193. Foreign body removal, 194. Dilation, 195. For guide wire insertion, 196. So these are the code section. Scopy inserted through oral. And the same like that. This is the code section for same like that. But the scopy was inserted through nasal. Flexible transnasal. Same like that. Brushing, washing, 197. Biopsy, 198. And see here, flexible oral, brushing, washing, 200. Submucosal injection, 201. So the reasons are same, guys. Here in ERC, esophagogastroduodenoscopy also same. Brushing, washing, 35. Injection, 36. The reasons are same. But according to the scopy, the code will differ. According to the scopy, the code will differ. Did you understand? Did you understand? First of all, you have to check the scopy. And next you have to check the reason.
43249.
43249. Okay. Others?
B, ma'am. 43249.
43249. Right. What is actually what type of scopy is used here?
Upper GA.
Yes. Sorry. Upper GA
Gastroduodenoscopy.
Yeah, correct. Is this does it reach the termination point or not?
Yes, ma'am.
Yes, it does. It successfully reached the duodenum. Am I right? For upper GA scopy, duodenum is a key point. That is a termination point. So it reached the termination point of duodenum. So what is the reason? Balloon dilation. So the reason is balloon dilation. Go for 43, less than 30 mm of diameter, 43249. 43249. Did you understand? Any doubt, any question? Okay. Now, try the next one.
Not there, no, ma'am.
Sorry?
Before code is not there, no, ma'am.
Which one, ma? Which one?
Before question, ma'am.
You're asking about the answer, am I right?
Yes, ma'am.
So the answer is 43249. That is the answer.
Where it is, ma'am?
Go on and check that. It may be a re-sequenced code. Go on and check with the book 43249.
Where it is, ma'am?
Guys, anyone, can you tell me that page number?
Where is the book is, ma'am? Hello?
1 minute. I show. Do you see my screen? Please just wait.
I don't have book, ma'am.
Oh, you are asking about the book copy. Okay. This is your first session?
Yes, ma'am.
Okay, your name, please.
Gayatri, ma'am.
1 minute. 1 minute. I just forward that book in our WhatsApp group. 1 minute, please wait. So now try this question. Krishna Priya? Krishna Priya, are you there? Krishna Priya? பார்த்தேன் தேங்க்ஸ்ங்க 23 சரி நான் தான் பார்த்துட்டு
B, ma'am.
Yeah, B is the correct answer. B is the correct answer. Krishna Priya, but you are joined correct answer. Krishna Priya, text me your pending chapters. Okay. Then these are the core section for ERCP. Same like that. You have to check the termination pointers reached or not. That's it. And the laparoscopy, by using guys, is there any doubt in scopy? Is there any doubt in the scopy? Okay.
Ma'am, if the end is not reached, what to do, ma'am? You said?
If the scopy does not reach the termination point, means you should up and modify 52 or 53. So 52, if repeated examination is not planned, means go for 52. 53, if repeated examination is planned, means go for 53. Did you understand now?
It's not reached 52, right?
Or 53. Not reached, should up and modify 52 or 53. So when we use 52 means repeated examination is not planned, go for 52. So repeated examination is planned means go for 53. Clear now? So if the scopy does not reach the termination point means we should up and modify either 52 or 53. In which situation we have to up and modify 52 means repeated examination is not planned means go for 52. Repeated examination is planned means go for 53. That's it. Clear now?
Yes.
See you later. Okay. So sigmoidoscopy and colonoscopy, proctosigmoidoscopy, everything we'll discuss in the upcoming classes. So for the laparoscopy, so surgeon use laparoscopy for what? To remove the muscle from esophagus. So by using of laparoscopy, doctors remove the muscle from esophagus. Okay, so that is esophagomyotomy. So for funduloplasty, repairs, by using of laparoscopy, doctor make a suture as fundus. What are the parts of funduloplasty means? Fundus is a parts of stomach. So surgeon make a suture at fundus, go for 280. Now, by using of laparoscopy, now surgeon perform the procedure for paraesophageal hernia. For paraesophageal hernia means go for 43281. 43281 for laparoscopical surgery repair of paraesophageal hernia. So according to the procedure, we have to select the appropriate tool here. Now, next.
Ma'am, once will you put before question, ma'am? Okay, ma'am.
So these are the direct coding. Pyloroplasty. Fundus, body, antrum or pylorus is the term of the parts of stomach. For pyloroplasty, surgeon make a suture at a pylorus, go for 43800. Gastroduodenostomy, surgeon make a artificial opening from stomach to duodenum. So to understand this procedure, terminology is important. Ostomy means artificial opening. Surgeon make a artificial opening from stomach to duodenum, go for 810. From stomach to jejunum means go for 20 without vagotomy and with vagotomy. Vagus is nothing but vagus is one of the nerves. When we are make a cut on the vagus means it stop the secretion of HCl. Okay, so suppose why here surgeon cut the piece of vagus nerve. Why here surgeon cut the vagus nerve means, so for vagotomy, if when a doctor cut the vagus nerve means it stops the secretion of HCl in our stomach. So that is with the vagotomy. With the vagotomy 825, without vagotomy 820. So 830, surgeon make a artificial opening on stomach only for feeding purpose. For adult 830, for neonatal 831. What is the duration of neonatal period?
0 to 28 days.
0 to 28 days. Birth through following, yeah, correct. Birth through following 28 days are considered as neonatal period. Okay. For neonatal period, for adult means go for 30. For neonatal means go for 830. Then what is the meaning of adgerson? Adgerson? Gel-like material. Okay, glue-like. Adgerson is nothing but it's a glue-like material. It will produce anywhere of our body. So lysis means destroy. Lysis means destroy. Destruction of adgerson, go for 44005. Destruction of adgerson, go for 00005. For duodenotomy, surgeon make a cut on the duodenum. For what? For exploration. தலை வலிக்குதா ஆக்சுவலி எப்பதான் நிறுத்துவாங்கன்னே தெரியல. ஒரு வாரம் ஆகுமா? அதுக்குள்ள நம்ம ஒரு வழியா இருந்துருக்கு. Surgeon make a cut on the duodenum for exploration, biopsy or foreign for 10. Now, here check that what is the procedure of 44015. What is the procedure?
Jejunostomy.
Jejunostomy. So for what? For tube incision, for tube or catheter incision. To insert the tube or needle catheter into the jejunum. Okay, for into the jejunum, go for 50. Enterotomy. Entero means small intestine. Surgeon make a cut on the small intestine other than duodenum because we have a code for duodenum separately. 44010 for duodenum. So other than duodenum means for jejunum or ileum go for 20. So what is the reason for exploration, biopsy, foreign body removal 20? For decompression means 21. Then 44025 for colotomy. Colo means large intestine. Entero means small intestine. Colotomy means large intestine. Surgeon make a cut on the colon for same like that for exploration, biopsy, foreign body removal 44025. Okay, that's it. உங்கள்ட்ட கீர்த்திட்ட கேட்க சொல்லுங்க 10 to 12. Now surgeon laparotomy means surgeon make a cut on the stomach to obtain the sample. Surgeon directly make a laparo means abdomen. Surgeon make a cut on the abdomen. Surgeon make a cut on the abdomen to obtain the sample from stomach. Go for 43605. 43610 excision removal. Removal of benign tumor or ulcer from stomach. Removal of benign or ulcer. Benign tumor or ulcer means go for 610. For malignant tumor means go for 611. Then 620 for gastrectomy. Gastrectomy means removal of stomach. Total gastrectomy and partial gastrectomy. In gastrectomy, we have two classification. In gastrectomy, we have two classification. Total gastrectomy. Gastrectomy means removal of stomach, complete removal of stomach or partial removal of stomach. Okay. Total gastrectomy and this is a partial gastrectomy. Total gastrectomy and partial gastrectomy. In total gastrectomy, that it's also called as Rowex NY anastomosis. Totally remove the stomach and the rest of the part is connected with the jejunum. Rest of the part is connected with the jejunum. See that in that gastrectomy, Rowex Y anastomosis means go for 261. So here that means here this is a near total. Only a 5% of stomach is there. Only a 5% of stomach is there. By a 10% of stomach is there. So that is near total. For total or near total, go for 20 to 22. Total or near total gastrectomy, go for 620 to 22. For partial means, doctor just remove the 50 or 60% of stomach only. Doctor just remove the 50 or 60% of stomach only, that is partial. So far, Rowex NY reconstruction 261. Esophagoenterostomy, that means completely remove the stomach and the small intestine is directly connected with the esophagus. That is esophagoenterostomy. So doctors completely remove the stomach. அது ஓடலையா ஆஷிக்? ஆஷிக் அது ஓடல? ஹீட்டா இருக்க மாதிரி இருக்கு. Yeah. So total or திடீர்னு கம்மியாயிடுச்சு. Total or near total. That means doctor completely remove the stomach. Doctor completely remove the stomach and esophagus is directly connected with the small intestine means that is 43620. 43621. The remaining part of the stomach is, that means 10% of stomach. 10 or 5% of stomach is connected with the jejunum. That is Rowex NY reconstruction. For intestinal pouch, so doctor create a, after completion of stomach removal, after completion of gastrectomy, doctor create a pouch-like structure in small intestine means go for 43622. After completion of small intestine, after completion of gastrectomy, doctor create a pouch-like structure in the small intestine means go for 43622. Then 43631, gastrectomy partial. That means partially remove the stomach and the remaining part of the stomach is connected with the duodenum 31. If the remaining part of the stomach is connected with the jejunum means go for 32. Clear? Did you understand that gastrectomy procedure? Because this is a very, very important. Did you understand?
Ma'am, the percentage, the partial, total, explain, ma'am.
So no, don't worry. Doctor will give a direct documentation for total or partial. Usually, in that partial gastrectomy, stomach is connected with the duodenum because still the portion of stomach is still present. So that's why the remaining portion of stomach is connected with the duodenum. In remaining portion of stomach is connected with the jejunum. But in that above section, here in this first section, completely remove the stomach and the esophagus directly connected with the intestine. So in Rowex NY anastomosis only, we have a 10%. So the doctor directly give the name of the procedure, Rowex NY reconstruction. So the name of the procedure given by the provider directly. For Rowex N means go for 21. Suppose doctor create a small intestinal pouch means go for 22. So did you understand? So the doctor give a direct documentation for all of that. Any doubt?
Oh.
No. What is the meaning of anastomosis actually? What is the meaning of anastomosis?
Joining.
Yeah, anastomosis means joining. See that 43725 for NG tube. 43725 for 43752 for NG tube insertion. So inserting the tube through mouth or oral to stomach. Orogastric tube. So insert the tube through mouth or oral and that tube is terminated at the stomach for feeding purpose. Usually for this NG tube placement, usually this type of procedure is usually performed by nurse only. No need of physician skill. Okay. So you for inserting of NG tube, nurse is enough. Nurse service enough to insert the tube to insert the NG tube or gastric intubation. But for this procedure, if physician skill is necessary means go for 52. So underline that requiring the physician skill. Usually this tube has been placed by nurse only. Suppose sometimes nurse can't able to insert the tube successfully. In that case, doctor will complete the procedure. So physician skill is necessary to complete the procedure means go for 43752 for inserting of tube from mouth to stomach or nasal to stomach for feeding purpose. Gastric intubation. For directly insert the tube into the stomach go for 53. Intubation. So for gastric intubation go for 43753. Usually all of these procedures are done by nurse only. All of these procedures are done by nurse only. Suppose a physician skill is necessary to complete the procedure means go for 43753. Okay. Is there any doubt in this section? In this slide? Any doubt? No, ma'am. Then colonoscopy. What is the termination point for colonoscopy? What is the termination? Cecum. Cecum is the termination point of colonoscopy. Here we have one decision tree. Here we have one decision tree. By using up this decision tree, you can easily append the modifier. We can use easily report the code also. So for colonoscopy, colonoscopy is given for administered for a patient for a diagnostic procedure or therapeutic. Reason. You have to check the reason. Guys, the meeting will going to end within 1 minute. So please rejoin by the same link. So the scopy, there are two purposes. There are two reasons. One is for scopy is inserted for diagnostic procedure. Another one is inserted for therapeutic procedure. Diagnostic means it's a procedure. See that. So, colonoscopy through anus or rectum, and see that this is a splenic fluxion. It does not reach splenic fluxion. So go for 45330. You should consider it as a flexible sigmoidoscopy. So here, this is the part of sigmoid colon. This is a sigmoid colon. So it does not reach the splenic fluxion, means you should consider it as a flexible sigmoidoscopy 45330. But it beyond the splenic fluxion, but it does not reach the cecum, means go for 45378 with the modifier 53. Beyond the splenic fluxion, but it does not reach the cecum, means go for 45378 with the modifier 53. But here we have one change in colonoscopy. If for colonoscopy diagnostic, we should upon modifier 53. For therapeutic mean, we should upon modifier 52. For colonoscopy, diagnostic mean should upon modifier 53. For therapeutic mean, you should upon modifier 52. That is a small change in colonoscopy. Suppose if it is reach the cecum, means, guys, am I audible? Am I audible? So suppose if it is successfully reached the duodenum, means cecum, means go for 45378. 45378. Okay. Go for no need of modifier. Then therapeutic procedure. Therapeutic procedure does not reach splenic fluxion, means we should consider as a flexible sigmoidoscopy from 31 to 47. Guys, 1 minute. Reach splenic fluxion, means we should consider as a flexible sigmoidoscopy and should report the code from 31 to 47. Suppose it crosses beyond the splenic fluxion, but it does not reach the cecum. It crosses splenic fluxion, guys, but it does not reach the cecum, means should report 45379 to 98 based on the reason. Based on the reason, should report 45379 to 98 with the modifier 52. With the modifier 52.
Modifier 53 implies discontinued procedure, ma'am. And why are we actually using it here for the diagnostic procedure? What is the reason?
That is the rules, because if suppose if the scopy has inserted through mouth or oral, means patient can't. It will be a chance for respiratory distress like that. Patient can be able to feel a pain also, but through anus means patient there is no complication comparing with the endoscope. For colonoscopy, there is no major complication. So that's why it will be a chance to plan for the repeated examination. Okay. So it is a plan to repeat it for the, there is a maximum chance to repeat for plan for the repeated examination. That's why here they are appending modifier 53.
Oh, okay.
Okay. So far, but for 52 modifier, I mean, that is a discontinued procedure. So for 52, we should, for colonoscopy, it crosses splenic fluxion, but it does not reach the cecum, means go for 52 modifier. Suppose it successfully reach the cecum, means go for 45379 to 45398. No need of modifier. So here we have one change. For diagnostic means should upon modifier 53. For a diagnosed therapeutic means should upon modifier 52. Whatever it is, the termination point is cecum.
Yes, ma'am.
Yes, ma'am. Then this is a definition. This definition is also present in our CPT book. So for proctosigmoidoscopy, what is the meaning of that sigmoidoscopy? Meaning for that scopy means that examine the rectum portion of sigmoid colon. So it completely, procto means rectum, am I right? It completely examine the rectum and a portion of colon. The sigmoid colon go for proctosigmoidoscopy. Sigmoidoscopy means entire rectum to sigmoid colon. It examine from rectum to sigmoid colon. Colonoscopy means from rectum to cecum. Am I right? So colonoscopy means from rectum to cecum, that is colonoscopy. Colonoscopy through stoma means, see that, stoma means opening. Doctors directly make a hole on the abdomen, hole on our abdomen and insert the tube. And stoma means from opening to cecum. Here scope does not inserted through anus. The surgeon just make a hole on our abdomen and insert the scopy. From that stoma, it examine the cecum also. So through stoma to cecum. Colonoscopy through stoma means from colonostomy stoma to cecum. That is colonoscopy through stoma. Now this is a general definition. So ileoscopy through stoma means scopy inserted through hole to view the ileum. What is this a diagnostic or a therapeutic procedure, guys?
Diagnostic.
For diagnostic purpose, surgeon make a hole on our abdomen to view the ileum. So ileoscopy means that scopy is used to view the ileum. That is the name of the scopy. Appendectomy, removal of appendix. Appendectomy means removal of appendix. In appendectomy, we have two classification: open surgery and laparoscopic surgery. In appendectomy, we have two classification: open surgery. For open surgery, 44950. For laparoscopic removal of appendix, go for 44970. 44970 for laparoscopic appendectomy. So for appendectomy, if ruptured appendix means go for 960. So appendectomy alone 44950. So if suppose for ruptured appendix means go for 960. Then here these two informations are very, very important. Indicated means pre-planned. Indicated means pre-planned. Take a meaning. Indicated means pre-planned. So indicated means pre-planned. Doctor previously planned appendectomy with another major procedure. Doctor previously planned for a appendectomy with another major procedure. That is indicated. That means along with the hysterectomy, doctors also perform the procedure for appendectomy. Okay, along with another major procedure, doctors also perform the procedure of appendix. Go for 4. We should report uterus removal with the appendectomy. Get rid. So 44950. Should you report, for example? Uterus removal. Uterus removal with appendectomy. Okay, uterus removal is the appendectomy. So here, hysterectomy is our primary code. Followed that, we should report the SADAN code. Hysterectomy is our primary code. Followed that, we should report the SADAN code. Did you understand the procedure? So indicated means pre-planned. Pre-planned procedure. Did you understand the meaning?
Yes,
Please
ma'am.
say yes. Understand?
Yes, ma'am.
Incidental mean on the spot finding. On the spot findings. On the spot, incidentally, accidentally. So during another major surgery only, accidentally doctor identify the appendix and remove the appendix. So guys, please listen. Accidentally, during another major surgery, doctors accidentally find out the problem, and remove the appendix also. So here we have to report this 44950 along with the modifier 52. So that means during 1 minute. Okay. During the procedure of diverticulitis. During the procedure of diverticulitis only, doctor identify the problem of appendix and remove the appendix also. So here our main procedure should be diverticulitis removal. Along with, we should report this code 44950 with the modifier 52. Did you understand?
Can you
Did you
repeat
understand?
again, ma'am?
Okay, actually, now doctor perform the procedure of hepatectomy. Okay. ஆஷிக் இதை கொஞ்சம் கம்மி பண்ணுங்களேன். ரொம்ப வருது, ரொம்ப வேகமா வருது. So doctor perform the procedure of appendectomy during appendectomy procedure. Okay. During appendectomy, during this procedure, incidentally found out the appendix. During appendectomy procedure, physician incidentally find, that means at the time only he find out the problem of appendix. Incidentally find out the problem of appendix. So here we have to report the code for hepatectomy. Then should report the appendix code 44950 with the modifier 52. 44950 with the modifier 52. But in this procedure, for indicated mean, we should report the SADAN code. For incidental mean, we should report the appendectomy code along with the modifier 52. Okay, did you understand now?
Yes, ma'am. Ma'am, if it's indicated, then no need to append modifier 53, ma'am.
For indicated means should report add and go. For indicated means should report add and go. For incidental only, we should append modifier 52. Okay?
Okay, ma'am. Regarding for the CPC exam,
Okay.
so if two different procedural codes are given, and we should code when we code, we should code it in the sequential order or any order is fine, ma'am, because the options contain both sequential order and the reversal order as well.
Actually, if first of all, you should give a priority for highest intensive procedure. For example, doctor during the same session, if a doctor perform both highest and lowest severity procedure means first we should report the code for highest severity. For example, arm fracture and skull fracture. Comparing with these two, which one is the highest?
Skull fracture.
So first we should report the code for skull fracture treatment, and next we should report the code for leg fracture. Okay. So based on the severity, we have to select not only for CPT, in ICD also we have to give a priority for severity.
So it doesn't matter if it's sequential or not. For example, in the same example, if the arm fracture is first mentioned, followed by the skull fracture, we should anyways append, code for the skull fracture first and arm fracture
Following
second.
the leg fracture. Yeah, following the arm fracture. First we should report the code for skull fracture. Next we should report the code for leg fracture.
Okay, only based on severity. Okay.
Oh yeah, based on severity.
Okay.
So because doctors give importance to cure the highest severity condition first, am I right? So that's why here also we have to report the code based on the severity.
Okay.
Then hemorrhoidectomy. Hemorrhoid means, I think everybody know that piles. So in that hemorrhoidectomy for internal and external, we have two classification, internal hemorrhoid and external hemorrhoid. Internal hemorrhoid, rubber band ligation. See that image. So surgeon may use rubber band to ligate, to remove the hemorrhoid, internal hemorrhoid, go for 46221. 46221 for removal of hemorrhoid by using of rubber band. So other than rubber band, like a ligator, suppose if a doctor use instrument to remove the hemorrhoid means go for 45 for single hemorrhoid. For 2 or more hemorrhoid, go for 46. For single hemorrhoid, 46945. For 2 or more hemorrhoid means go for 46946. So these two code section for internal hemorrhoid and this is a code section for external hemorrhoid. 46250 for external hemorrhoid, 2 or more column. So for 2 or more hemorrhoid, 50. For a single external hemorrhoid means go for the unlisted procedure code. Okay guys, please listen. For 2 or more external hemorrhoid, go for 46250. For single hemorrhoid, should report the unlisted procedure code. And 46255 for both internal and external hemorrhoid. Suppose if a patient has both internal and external hemorrhoid means go for the code section of 46256, 55 or 56. So these are the direct coding. First of all, you have to check whether the hemorrhoid is internal or external. So if it is internal means you have to check the rubber band is used or not. For external means we have to concentrate on the number of hemorrhoids. That's it. Any doubt? Any doubt in this question?
No, ma'am.
Okay. Now this is a very, very important one. So during hemorrhoidectomy, if a doctor use anoscopy means code only for anoscopy, because anoscopy is a diagnostic scopy. So by using of anoscopy, first of all, doctor confirm the condition. After that, he remove the hemorrhoid. So anoscopy with the hemorrhoidectomy means code only for hemorrhoidectomy. Okay. Please take a note. Very, very important. See that this is a percutaneous method. Surgeon use needle to obtain the sample from liver. Sorry. Surgeon use needle to obtain the sample from liver. Go for 47000. Then 47001 along with it. So guys, please listen. At the time of other major procedure. So during another major procedure, doctor also perform the liver biopsy means we should report the SAD and code. For example, during pancreaticectomy, doctor also obtained the sample from liver means pancreaticectomy is our primary code. Next, we should report the SAD and code. During pancreaticectomy, if doctor also obtain the sample from liver means pancreaticectomy is our main term and we should report this add-on code 47001. Okay, so that means at the time of other major procedure, if doctor also perform the procedure of liver biopsy means go for this add-on code. Clear? Is there any doubt in this question? Because this is a very, very important. Any doubt?
Repeat once again, ma'am.
So during another major surgery, doctor also take the sample from liver means we should report the SAD and code. For example, during pancreaticectomy, during the procedure of pancreaticectomy, doctor also take the sample from liver means pancreaticectomy is our primary code. After that, we should report the SAD and code for liver biopsy. After that, we should report the SAD and code for liver biopsy. Clear?
Yes, ma'am.
Then these are the direct coding. Cholecystostomy. Cholecystomy means gallbladder removal of artificial opening of gallbladder 47490. Doctor make a artificial opening from gallbladder 47490. So 47531 injection. Injection given for cholangiography. What is the reason for diagnostic? Injection given for diagnostic cholangiography through the existing axis 31, new axis 32. We already discussed about that axis. Axis means pathway, route. Axis means pathway or route. Doctor reach the organ through the particular artery or vein. So through the existing old pathway means 31, new pathway means 32. As a default, we should report the code for new access. We need a proper documentation for existing access. And 47533 for insert the placement of drainage catheter, biliary. Procedure is placement of catheter, drainage catheter at biliary. Go for 33. 33 for external. Internal to external means go for 34. External means for biliary drainage catheter, the catheter terminate at small intestine means that is internal to external. So the catheter, biliary drainage catheter, the catheter terminate at a small intestine means that is internal to external. The catheter not terminate at a small intestine. Catheter not terminate. Not terminate at a small intestine means that is external. Not terminate at the small intestine means that is external. Take a note. So if a catheter not terminate at the small intestine means that is external. If the catheter is terminate at the small intestine means that is not terminate mean external, terminate mean internal to external. That's it. Did you understand? Clear? Guys, am I audible? Point of biliary catheter. Okay, you have to check the termination point of biliary catheter. Then 47535 conversion of external biliary drainage catheter. Conversion of external biliary drainage catheter. That means doctor remove the external catheter and insert the internal to external catheter. Conversion means remove the one type of device and insert the another type of device. Am I right? So here doctor remove the external drainage catheter and insert the internal to external means go for 35. 36 exchange. So if remove the old device and insert the same type of device. If remove the external catheter and insert the external, or remove the old internal to external and insert the same one. So for exchange of catheter 36, conversion of catheter 35. Did you understand? Any doubt in this question? Sorry, in this procedure? Any doubt? Please say yes or no.